Welcome everyone. We'll make a start. It's just clicked over after 1 o'clock. Good afternoon and welcome to you all, and thank you for joining our webinar today. I'm Angela Jones from Monash Partners and I lead the Monash Partners Consumer and Community Involvement Platform. We're delighted to bring you another lunchtime seminar, and the seminar we're bringing you today is very much a collaborative effort with our colleagues at the Consumer and Community Involvement Program through the Western Australian Health Translation Network. The WA-HTN, like Monash Partners, is an NHMRC accredited research translation centre. It's a large-scale partnership between many research, teaching and health service organisations, and we've been delighted to work with our colleagues in Western Australia for some years now, particularly Ben and Deb, who are joining me today. Ben and Deb are also joined by Beer and Geoff Corcoran, and we extend a very warm welcome to you, Kelly and Geoff, and thank you so much for joining us. I'd like to take a moment to acknowledge the traditional custodians of the land on which we are standing, and in a spirit of reconciliation, I pay my respects to elders past, present and emerging. I extend that respect to any Aboriginal and Torres Strait Islander joining our webinar. Wherever you are, we acknowledge and pay respects to our First Peoples. The focus of today's webinar is how do we build capacity for consumers to engage in a meaningful way in research and healthcare improvement. And we're going to learn from the experience of some of our colleagues in Western Australia who are really leading in this work. Our purpose is to highlight some of the principles, practices, and provide some practical exemplars of some of this work in action. And in doing so, we're connecting healthcare providers, managers, researchers, and consumers. We're trying to learn from each other, ask questions, and identify mutual areas of interest. To let you know, today's seminar is being audio and video recorded. We will circulate a copy to everybody who attended, and also make the recording available on our websites also for anyone who'd like to go to it post-event. We'll also save the chat. And with that summary, that recording will send a summary of the key points from today's presentation. Please, throughout the webinar, feel free to pop your questions into the Q&A if you could, and feel free to upvote others that are of particular interest to you also. Just a little bit of an overview of today's seminar program. In a couple of minutes, I'm going to hand over to Deb, who's going to provide a little bit of an overview of the Consumer and Community Involvement Program through the Western Australian Health Translation Network. And then we're going to hand over to Ben to kind of lead a little bit of a conversation really with Kelly and Geoff around how they work together, the nature of their program, and some of the learnings they have from the way they've worked together and where consumer involvement has really strengthened research. There will be an opportunity for people to ask questions, and then we'll wrap up just before 2 o'clock. Just to highlight before I hand over to Deb, some resources that are available to you all. Monash Partners has developed some online education modules and resources available on our website. They're evidence-based, include remuneration guidelines, tip sheets about how to work with consumers in this virtual space, and a whole lot of other resources as well. To anyone in the Monash Partners Network, we also provide advice and support to research teams coming to do this, and please reach out to us via email. Recently, the Western Australian Health Translation Network completed a really significant body of work around bringing together a consumer and community involvement handbook that provides practical guidance to organisations, researchers, clinicians, consumers and funding bodies around how to do consumer and community involvement, and that is available online, and the link is there. And they've also launched a free introductory 30-minute course, which is a very valuable introduction to consumer and community involvement, and it's also available on the website link there, through the website link there as well. Just to highlight opportunities to connect with us through Twitter and also through our website. Without further much ado, I am going to stop sharing my slides now, and it's my great pleasure to introduce Deb Langridge to you all. Deb is the head of the Consumer and Community Involvement Program at the Western Australian Health Translation Network, and is going to provide us with an overview of the program as it currently runs. Over to you, Deb, and thanks so much for supporting our event today.
Thanks, Angela. It's an absolute privilege to show our collaboration of how we love working with you guys at Monash. It's fantastic. And can I also introduce another key member of the CCI program team, Ben Horgan. He's our senior CCI coordinator. And you will hear and appreciate all of his experience and expertise later on after I've finished. Just a very brief introduction about who we are and how we work. So I'll just share my screen to start with. So I know, thank you, Angela, for giving an acknowledgement of country. For us, so for Ben, Kelly and I, we're on Noongar Budjar land, so meeting with you from WA, and we'd like to acknowledge the traditional custodians throughout Western Australia, their continuing connection to the land, water and community, and to pay our respects to all members of the Aboriginal communities and their culture, and to elders past and present. It's an important part of what we do, and we're really compassionate about acknowledging and involving them in our work. Just to begin, for those of you who may or may not have heard about the CCI program, as Angela has said, we're part of the WA Health Translation Network. So we're one of 10 different health translation networks across Australia, of which Monash Partners are another. We work together on a national basis, but the CCI program, this is who we are. This is why we come to work every day. So we're here to support consumers, community members and researchers to work in partnership and to make decisions about health priorities. So what is it that we research, how we research it, and then what's done with it, how and where it should go and impact policy and practice. We come to work each day, as I said, to improve lives by ensuring voices of people with lived experience are heard and understood and then applied to have an impact and to make a difference. And you'll hear lots from, not from me, but from Kelly and Geoff later on about how they've done that and why they do it as well. If I can just give a brief outline of the way in which the CCI program works, it's a little bit different to a lot of the other health translation networks across Australia, and we're based on an international best practice model. So we provide support, CCI support and services WA-wide, so to anyone within WA and interstate, actually, we do that as well. We have a membership of over 3,000 consumers, so people with lived experience, as well as organisations, not-for-profits, community groups as well, and researchers. We have partner agreements with universities, with medical research institutes within WA. Our state government, Ben, has been working with the Research Innovation Office based within the heart of the Department of Health. And we also work and support all of the WA health service providers, area health services, whatever the term is in Victoria, to provide CCI support and services. But I think our secret weapon in terms of what we do and how we connect and why we love to do it, but also how I think we've been doing it well, are our CCI coordinators, of which Ben is our senior CCI coordinator with the CCI program. And our CCI coordinators, they work on site with our partners. They're the face and breadth and contact person for our universities, our medical research institutes, state governments, all of the people we work with. They're the go-to. And so they actually personalise and establish personal relationships with our researchers, with our executives, with our consumers, to help tailor and find out the what of CCI. So what is it that would work best? And then support and connect to the CCI programs, workshops, training, our database, as I said, of our amazing people with lived experience, to help find and match the most amazing people that we can find to the best fit for research projects and innovation projects. And so our CCI coordinators, we've found, help turn the theory of CCI into everyday practice. And we've seen, I think that's something that we love to do, but also it helps provide the support in more than just a theoretical way, which I think has helped link CCI and make it real, to turn it into the how-to. In terms of the support that we provide for researchers, consumers and organisations, as Angela highlighted briefly, we actually have a lot of resources that our CCI coordinators use, but also the CCI program team use to upskill, to help turn the theory into practice of the how-to and the why of CCI. We deliver those tools and resources and training programs to all different levels of people's understanding and expertise in CCI. So, and we can tailor those generalised programs into more specific programs depending on the need and the people that we're working with. So that's, as already mentioned, our e-course was was the first one to be launched nationally, and it's free to anyone and everyone. Go onto our website and you can find it. It's meant to be a 30-minute, up to 30 minutes. You can do it in less than that. Just a walkthrough of what on earth CCI is and what does it look like in theory. And so we use that for anyone and everyone. So for consumers, people with lived experience, our researchers, our organisations, anybody at all who wants to know what on earth CCI is and what do they do next. That also is supported by the handbook, the CCI handbook, which was a task that we actually worked with a lot of the other health translation networks on putting that together. Again, it's an online resource to help you get started and to give you some of the steps. The next phase of us to be able to build capacity of researchers and consumers, people with lived experience, is then our generalised trainings programs that we run. And they're online, especially during the last 2.5 years. We made that flip to online, but we love doing them in person as well. There's nothing better than being up close and personal and being able to just really connect and make relationships in those training programs. And they're the beginnings. Again, it's going from our theory of an e-course or a handbook into the how-to, the hands-on with some practical examples. And they revolve around CCI in practice, so that very introduction beginning of the practical part, and then communicating CCI and what that looks like as well. And then we have lots of other tailored resources, training and workshop that Ben and our other CCI coordinators use depending on who it is that they're working with. And those tailored programs are for consumers, they're for researchers, but often what we try to do is bring everybody together so people can actually see that people with lived experience are real and lovely and magnificent, and also that researchers don't all wear white coats, and although you may have one on and that's fine, but also that we have so much in common. And so those training programs are meant to do that, to actually humanise, for lack of a better word, and to make real what CCI can look like. Many researchers actually say, look, we only do test tubes, we don't do people, and we hear that all the time. And so that's where I suppose the CCI program has had a significant role. So our amazing living, breathing CCI coordinators are able to step in and take the people component where some researchers may not feel confident in doing that, and help guide, support and encourage to aim to build the confidence of the people with lived experience as well as the researchers in this whole beginning of an amazing relationship that develops. And you'll hear and see that firsthand when Geoff and Kelly and Ben begin to chat in just a few minutes. I suppose the other thing that we do that is that we actually match our consumers with our researchers, and that's another aspect of our program that is quite specific and quite significant. So it's not just to go outside and see who's willing to turn up to get a cup of coffee or tea. We actually tailor, and that's the role of our CCI program coordinators, to get our to find out who are the people that are needed and would make the most amazing addition to a research team or a research project with their lived experience. And we find those people, connect them, and don't do a drop and run. We actually remain and introduce and get alongside people. So it's, I suppose, this is very politically incorrect to say, and can I just say that I don't know anything about Tinder, but our matching service is kind of like a Tinder-esque program where we find the consumers and we match them with researchers in all of the right ways, not all of the wrong ways. So that's I think another part of the work that we do that leads to those relationships connecting and becoming real, which then it becomes the secret weapon for CCI in what happens next. The only other thing I suppose I would say just before I hand over is that our success, I think, has also been helped by us sharing stories of what CCI looks like and how it's worked best, but also honesty in don't do this, or we tried this and it was okay, but maybe we do it differently. People expect that me in my role as heading up the CCI program and Ben as CCI coordinator, they expect for us to tell people that this is the most important thing that you should do, because that comes with our role and we're passionate about it. But being able to use the voices of people with lived experience and researchers that you'll hear about in just a sec, to be able to put the reality into it, those voices are the things that change and make amazing things happen. And so you'll see on our website, we've got an amazing video series where we've brought together researchers and the amazing people with lived experience that they've worked with. And so we can carry that around and share that video to say, look, it's not just us, listen to these amazing people and they'll tell you why this is important and how to best do it. So just some ideas, I suppose, and a bit of an introduction to the CCI program. We're an ongoing work in progress, and we are by far not the expert across the board. But our willingness, part of the work that we do, is to share and build and collaborate with anyone in the CCI area of research, because we all need to be working together to raise the profile and the awareness and the significance of this work. So I've just very quickly put our contact details so that if you're wanting to find out more, obviously go to our website or get in contact or follow us on social media. That's a good way, a good platform to see what we're doing. So what I'll do now is if I can introduce, really, get to the VIPs, because they really are our VIPs. And Ben, as I've suggested before, Ben Horgan is our Senior CCI Coordinator with one of our universities and the Department of Health Research Innovation Office. So I'm going to leave it to you, Ben, and Kelly and Geoff to really, tell us what it's all about, but to share the how and why and the success stories. Thank you so much.
Thanks, Deb. That's terrific. Gives us a really good background to the conversation that we're going to have. And it is really a privilege to be able to speak with Kelly and Geoff today. I've had the honour of working with Kelly for quite a few years now through my work in WA, and Kelly has set up an amazing program. I usually start speaking with researchers around why they should be doing this and then how they should be doing this. And my first conversation with Kelly was neither of those things. She was already committed to it. She just wanted to double check that what she was doing was along the lines of best practice and the sorts of things that we preach. So it was actually a really good relationship to start, but I've learned just as much from Kelly and possibly more than what she has from me and the work that we do. So I was so pleased when Kelly accepted the opportunity to come on board with us today. And it's going to be great to hear from Geoff and his experience being involved with Kelly's team and how consumers have shaped the work that they have done going forward. So Kelly, it'd be great to start with just a bit of background. How did you enter into the world of consumer involvement? Where did it all begin?
Yeah, thanks, Ben, and thanks to everyone for inviting us onto this conversation and having us here today. Thanks for that amazing introduction. I mean, I think like everyone on the call today, this is a space we're all learning in and doing our best, and kind of just, it's an area of a bit of uncertainty and new, challenging, for all of us. So I'd absolutely say we're all in that together. And I've just got to quickly get in a really happy International Nurses Day to all the nurses out there. If there are any clinical research nurses like me out there, have a great International Nurses Day. You're amazing. So my interest, I guess, and passion in consumer involvement really started. So most of my research career has been over in the UK, even though I am an Aussie. I worked over there for quite a while with a group called the National Institute for Health Bioresource, which is based in Cambridge. And there we really were working predominantly with healthy volunteers in research. So that's a little bit of a different dynamic. And those of you working predominantly with volunteers will know that if people aren't engaged in your research or institute because of their relationship as a patient, it is a little bit different in perhaps some of the motivators and barriers to research as well. So really quickly, when we were working within that program, it was very clear that unless we really worked with consumers and really engaged people in our research in a way that was meaningful and made it pertinent to them, we just wouldn't succeed in what we were trying to do. So from the get-go, what I was able to see was just a really embedded culture of having consumers alongside. So adapting our research designs and practice, asking our consumers how they felt about what we're doing, how we acknowledge their contributions, sort of little things that added up really to just a culture of engagement. And I think that's something that has then for me just been a kind of standard part of practice. And we've seen in the UK as well some amazing examples of best practice coming out with some of the work they're doing with the Involve network of really centrally in government funding real investment in consumer involvement, which is starting to happen here, and there's amazing work we know being done. So I moved back to Australia 3 years ago and was fortunate to start working with the Myositis Discovery Program, which is based over in Perth in Western Australia. And that's led by Professor Mary Needham, a neurologist, who's also very passionate about people. And we were starting up a research program, really a foundation research program with laboratory and research arms. Myositis is a rare disease. It's a group of rare inflammatory muscle diseases. It's also Myositis Awareness Month. So that's another, if you haven't heard of it, go have a look. And within our program, again, we were really starting to establish a portfolio. So what was important to us was to really think about the pillars of our program. And consumer involvement was key to that, because from not only my experience, but Marily's experience as a clinician, and even our lab team understood that we're working in a rare disease. You know, we're not going to achieve anything if we don't really work alongside our patient group with that. So setting up and having those close consumer links is really important. So one of the first things we did when I was in role was we went over to the patient conference, which was in Adelaide that year, and met quite a few patients. We did a research road trip pre-COVID, of course, when we could travel, and that's where we were able to meet Geoff and others. And what we really saw was that appetite from people to be engaged in research. So not just to know what we were doing, but to contribute to it. And hence, really working with you guys in the CCIP here in WA to say, right, these are the things that we think we can do. We're not quite sure how to navigate them in this landscape. Perth was new to me, and of course the research sort of landscape was new to me there. So that's where that expertise can really come in, where you've got the intent, but then you have the information. So that's kind of a potted history.
Thanks, Kelly. Interested to hear from you, Geoff. So you're a member of Kelly's Consumer Advisory Panel. It's a national group. I'm interested, how did you hear about the group or the opportunity to be involved? And from your point of view, what motivated you to work in this space, to get involved with these researchers?
Yeah, thanks. So a bit of background. I'm retired on a rural property in the Yarra Valley in Victoria, and I'm a member of the Myositis Association of Australia. And I'm one of the lucky people who has inclusion body myositis, which is a muscle wasting disease with no known cause, no effective treatment and no cure. Got the trifecta there. So the disease, though not exclusively, typically impacts people in their 50s and older, usually takes years to diagnose. And initially you lose your quads, finger flexors impacted, and other muscles gradually becoming impacted. So dysphagia is a feature as well for a lot of people. And late stage stage patients can become effectively quadriplegic. So as a member of the Myositis Association, I was at a meeting where, or one in Adelaide first, where I first met Merrily, and then I met Merrily Needham and Kelly at a meeting in Melbourne, where they talked about the panel that they wanted to set up, and I sort of thought it was a way I could contribute to the research effort, you know, in an area where there's obviously strong personal interest, and it's pretty easy to do with my disease so far. And it's one way to do something useful in retirement. So that's essentially why I got into it, you know. And you didn't seem to, you know, you qualified pretty much if you could read and write, and you had a disease. So got it, you know. So that's it. And that's why I got into it. So they mustn't add enough numbers because I got accepted, you know.
So just Geoff, on that, has it been challenging, or being a national group, has that had its challenges with people from all over the country?
Not so much for me. I think it's more of a challenge for Kelly, because it's probably, and it is for the group to some extent, because you don't form the same level of bond with people as if you're rubbing shoulders with them. But for Kelly, it's pretty much like herding cats, and she's been exceptionally good at it, and probably with the you know, the stuff that you people do in a CCI space. It's one of the things where we were offered some training initially, and I didn't go for that, because probably at the time, you know, I read the fact sheets and they're pretty good. But what I realised later is that Kelly was the one who knew how to do all this stuff, and that's how she operated. So one of the things, you know, might have been of benefit that we all did it, because we would have understood how it works both ways, researcher to the user and back again, you know. So it's a bit of a closed loop, and that might have been of extra benefit, but we've learned a lot along the way from Kelly, you know.
Fabulous, mate.
And
thank you. And
can I just say to that, because that, you know, makes it sound like I do more than I do, because, you know, I try and do as well, lots, but yeah, not quite that much. When we started our panel, even though we knew what we had done and I had some experience with that, I've got to say it was still a learning process together, and it wasn't easy. You know, our first meeting, we were early adopters of Zoom pre-COVID. I wish we'd bought some shares back then for our research, but you know, it definitely wasn't that we absolutely had a first panel meeting and knew what we were doing. We've been going for just on 3 years now, and I reckon, what do you reckon, Geoff? The last year, I reckon we've got it pretty much nailed, what we're doing, how we run the meetings, how people interact. But, you know, it wasn't easy, and I think don't expect it to be easy. Expect it to feel messy and challenging as researchers, and for you to think, oh gosh, did that go well? Did it not? Because that's okay.
Well, all I could say is you've been able to fake it until you could make it. So it certainly worked pretty well, and whilst there was obvious learnings along the way, it all went pretty smoothly, I'd have to say. Yeah.
Geoff, I'll get back to those learnings in just a minute, because I think that's where the value of this conversation is going to be appreciated. But Kelly, as you know, I'm a bit of a storyteller myself, but I'd like you to tell a bit of a story right now. You've had some amazing success, and a lot of it you can credit to the work that you've done with the group and giving them a voice through what you've done. I'd love you to give us a little bit of a case study around the recent NHMRC success that you've had, where it started and how you ended up being successful. That'd be great if you could.
Yeah, no worries. I guess this is, as Ben says, one of the big impacts that we've had as a result from engaging with consumers. And I think critically, I would prefix that by saying asking for their help, because I think that's what we did in this and how we've sort of managed to get where we did with our grants. So, Many of you online will know the challenges of NHMRC grant applications, and particularly the challenges in rare diseases, even in common diseases as well. So when we first started our program, our research program, one of our key ambitions was to run a phase 3 clinical trial of a drug called sirolimus. This is an immune suppressive drug that's previously been used, still is used in kidney transplant. And there's some pilot work that's gone on overseas to know that this drug might have a disease-modifying effect for those with inclusion body myositis, which, as Geoff mentioned, is a really debilitating and progressively disabling disease that currently has no treatments. So we were very determined to run an international phase 3 clinical trial, multi-site clinical trial, because we felt it was important that we wanted to have international results that could quickly be applied to patients globally. So that was one of the key things. We didn't just want to do something locally, we wanted to do something on a big scale. So of course, NHMRC was where we were applying for different grants, clinical trials, cohort studies, international clinical trial collaborations, you name it. We were throwing in some pretty hard and fast grants, trying to involve our consumers, but really getting nowhere. And I think that's where our links with the Myositis Association Australia have really helped as well. So they're a national support group that Geoff is a part of as well, and do amazing work in advocating for patients. And they really, said to us, what can we do to help? And how can we help you to try and seek funding? So patients were writing, and family members were writing letters to their local, federal members of parliament. Many a ministerial reply was sent out. Professor Needham can apply for these grant these grant opportunities. But, it was a drip, drip, drip effect. We were getting a little bit more awareness out there. There are a few more representatives who'd heard of this disease, who knew what it was that we were trying to do. So we kept working with the association. I have to say they're really tenacious. So their president, Mrs. Christine Lowe, really tenacious in saying, can we do more? And we worked together to put in something called a targeted call for research, which is an opportunity for charities and support groups to actually help to lobby government to fund particular areas of unmet need. We weren't successful, but again, we kind of chipped away at the awareness. And the next part was that the Myositis Association were able to organise for a few of their members who lived in, or who still live in, Greg Hunt's electorate to go and see him. So this is really then advocating and lobbying and saying, right, this is our condition, this is how we live. We need funding for support and clinical trials, and we just can't get it because we're a small disease. There are lots of rare diseases. How do we break through this? And one of the things that the partnership then helped with between us was we were able to help with providing briefing notes, providing some information about the disease that they could take, and really kind of providing that scientific and research information that went alongside the real person centered approach as well. So following that, we're able to work on another grant because through the opportunity, the rare diseases, rare cancers, rare diseases and unmet needs grant opportunity. So that was coming up. So we thought we'll have another crack at it. And one of the key things that we did with that particular grant application is we asked our consumers via our panel to be really involved with the grant application. And that was a really eye-opening experience. And it was amazing because particularly, and Geoff, was a key player in the review. They looked at what we'd written, and particularly our first page and how we'd represented things and the potential impact and the unmet need, and just said, you haven't quite got that right. It doesn't represent us. This isn't what we, Geoff would be able to tell you better in his own words, but that made a critical impact on that first page read, on that first introduction of our grant. And actually we ended up putting in a lot more patient impact statements, really being able to articulate the importance of this particular clinical trial for patients. And that was in the January or the February, I think, of 2022. And in June, we were awarded 1.8 million from MRFF funding to start this clinical trial. And we've just started screening patients, so a little bit behind our timeline with COVID. So that really, I think in our minds, would not have been possible without the visibility and the awareness and the advocacy from not only our consumer panel, but the association. So it's just fantastic that we got there through that approach.
Thanks, Kelly. So just for people who are interested, we do apologise for the acronyms.
Oh,
so
sorry.
the NH&MRC, no, I was doing it as well, Kelly. It's you know, one of those things that we just do without even thinking about it these days, unfortunately, but we need to do better, there's no doubt. The NH&MRC is the National Health and Medical Research Council, the peak funding body in Australia, based in Canberra, and alongside them sit the MRFF, which is the Medical Research Futures Fund. Those two organisations hold the vast majority of the funding dollars that are available for researchers across Australia. And if you can get a grant from either one of those two bodies, you do set yourself up for the opportunity to do some great work, and helps with the track record as well. So we will do our best to avoid the acronyms from here on in. Apologies, everyone.
I'm pretty sure plain language is one of the things you guys advocate, so very sorry.
Yeah, we do, and yet we make the mistakes ourselves as well. So they're easily done, but we will try to be better, do this better. Geoff, so Kelly has just explained some of the ways in which the group has really informed, particularly that project. But it'd be really valuable to hear your thoughts on how you feel the group has been able to contribute to the work, not only within that project, but overall the research team, how you've been able to support them, and any key learnings that you think they've picked up, and maybe some key learnings of your own as well, buddy.
Yeah, thanks, Ben. Yeah, I think yeah, I've worked with several researchers on several different different research things so far, and as Kelly's just indicated, there's a tendency for researchers to be in their bubble. You know, they might use their terminology, etc. And we all do it. All professions do it, and the panel certainly helped address those sort of things with review of the documents and the processes with plain language, broader context, and fairly diverse, grounded perspectives to consider, you know, based on our lived experience, really. And research has resulted from some of our discussions. Like there was research done on assistive technology, for instance, that apparently came out of some of our discussions that we had. But my initial involvement, where we reviewed project impact statements, we don't get into the detail, of course, because you need a lifetime of research, of learning to get there. But around these funding applications, and it focuses on plain English, the flow of the argument, and reflection of our lived experience, and we, you know, able to highlight the costs of disease, and those costs are pretty important for the government if they're funding things. So you're looking at the cost to the families, cost to the society, and cost to the government. There's substantial cost to the government for say people with inclusion body myositis like myself when they're late stage, even if you're in my age care or you're in NDIS. So also we're able to highlight impact in some of these things, the impact on the carers, and often partners are carers as well. And the partners and carers and families travel a similar journey to, and it's an emotional journey too for a lot of them, regarding the gradual loss of physical capacity of the patient and the consequential increased support load, and that brings a lot of cost, a lot of consequence to the society and to the government too. And we've also provided feedback on processes around how the research is undertaken, the logistics of it, because we don't just jump out of bed in the morning, run through the shower and jump in a car and go, you know, with, you know, get a coffee for breakfast on the way. Typically it's about an hour and a half to 2 hours to get me ready in the morning. You know, so that's part of how you design processes, how research is undertaken, and also feedback on how surveys are designed. Is it picking up the key aspects from a user perspective? I notice we run into standard designs around surveys, which is interesting, and I can understand that. But, you know, you sort of think, gee, who designed these originally? Yeah, they obviously didn't have the CCI sort of influence at that time, you know. And I've also been able to work closely with a researcher on assistive technology paper as well, and then Kelly asked me to do a commentary paper on that, and to go with it for publication, which you know, been able to do, which highlights a range of other things, and really it highlights out of the research, you know, you keep the hypothesis sort of pretty grounded, and the relevance of any discoveries pretty grounded as well, and it highlights really what flows from that research, you know, because as you all would understand, you go about your hypothesis and you usually just raise more questions than your answer. So, and what I've been able to contribute, I suppose, is, you know, is informed by my personal journey and awareness of the detail of a lot of others with the same issue. And, you know, I know in a lot of cases, the neurologists and rheumatologists and so forth that are treating or trying to do something with this disease, you know, they're doing the medical thing, and I know with what Kelly's involved in, they're now going a bit past that, about more about the context of how you're travelling and so forth, and more than just the medical thing due to their research. But it's one of the things that I suppose we've been able to sort of broaden out the view as well, because there's a tendency to generalise or put things into categories, and that's a typical thing. But the broad spectrum of the patients with their lived experience sort of defies it, because, as I say with a lot of things, you know, you meet one person with inclusion body myositis, you've met one person, because there's such a broad range of the lived experience. You can have a fairly quick progression of the disease, or you can have had it for 20 years and you're still walking. You know, yes, anyway, I'm still waiting for that one. So it's, and also some of my feedback, I reflect on what I see as a major challenge, how we respond to disease based on location and the access to financial resources. You know, it came up through this latest research on assistive technology. There's big differences for those with inclusion body myositis depending on their location and source of funding. If you're self-funding or My Aged Care funded, you're in trouble. NDIS, far better so far. If you live in a rural area, access to everything is difficult. And, you know, so yes, you learn more about that, and you can feed that back as well. As also, like down the track, there's sort of challenges. One of the things that I sort of think about is that the role Kelly plays is really, really critical. And it doesn't concern me about how that's being done, because I think we're doing really well there. But what concerns me is who's the next one? Who's the backup? And how do we develop the next one with skills at that level? You know, so I just sort of think developing people into that sort of role is, gee, that's not an easy challenge, but it should be part of the plan, because that's what's really kept this going. Also, because in the panel members, they're all on the slide. You know, they're all all going downhill. You know, might be in wheelchairs, or they might have progressed to the next stage. And there's a real challenge in the wider myositis cohort, particularly those with the inclusion body myositis, for survey and research purposes, because I've thought about it and fed some of this back about the advanced disease people. They tend to disengage with the Myositis Association. So typically they're people well into their 70s or 80s. there's an inability to use the technology, or carers are unfamiliar with the technology, or they're in a nursing home without enough support to stay in contact. So it's very difficult for those patients to be an active panel member or an active member of the Myositis Association of Australia. So you tend to drop off, you lose the contact with those people who are most affected by this, and these are the people who drive a large part of the investment as well. So I think, you know, as outlined by Deb with the benefits of the training, I think we probably could have done a bit more in that. I didn't choose to do the training. I just read the fact sheets, but I probably didn't fully understand the, you know, the two-way nature of what you could learn, and learning more as I go. And we're probably about midway on that ladder of participation, which is pretty good. Probably pretty difficult to go much further than that, the way things are. But and given how limited research dollars are, you might not trust a group to invest them. You know, it's without a lot more knowledge. Anyway, that's pretty much it for me.
That's great, Geoff. Thank you so much. Just focusing on a couple of questions that have come through the Q&A. Kelly, interested in how you went about, so particularly with the most recent grants and maybe the successful one, because that'd be a good test case. How did you write your consumer involvement plan, and what did your budget look like for this?
Yeah, it's a great question. And from our perspective, I think, I can't remember if you get a page or half a page, but it wasn't enough, right? Because as you will have just heard from listening to Geoff talk, the richness of what we gain from involving consumers is just, I think it's so clear, isn't it? In respect to our consumer involvement plan and what we were writing, because we have consumer involvement really embedded so deeply within our research program, it's not a difficult section to write. A lot of the activity that we do is around dissemination of information back to our community and back to the wider community, sort of activities that we already have. So we usually do describe those. So we have an annual research update day, not only for our local patients, but we now host that on Zoom as well. And we have regular research newsletters and usually put information where we can within the Myositis Association newsletter as well. So we have a few different methods to disseminate research, which is often one of the things that grant funders are interested in, you know, what's the so what for the community. I think otherwise we do talk about the activity of our panel, and what we try and do with our consumer research panel, which has been, you know, more effective in the last 12 months as we've gained momentum, is to have researchers come and present their work quite early to us. So those who are interested in doing research projects in myositis will come and give perhaps a little PowerPoint or a little bit of information, and we can see where the consumer input fits at that point. So there's quite early, we're really encouraging very early engagement as well. For our NHMRC grant, because we had such close involvement from the association, we actually included the Myositis Association president, Miss Christine Lowe, on that application. She's an associate investigator on our grant, which is and has contributed also to the protocol. So our consumer panel are acknowledged within our protocol, as well as contributing authorship to that document. So I think consumer involvement, something I feel passionate about, is, you know, it's got to be meaningful, and it's got to be meaningful to your research. And, you know, we were able to talk about this at another session at Science on the Swan earlier this week. But I think that's really key to me, that, you know, you really need to understand where it's going to add value to what you're doing and really work on that area, because then it's going to be very easy to write those sections because you're doing it. So it's not about thinking what they want to hear, it's about just telling them what you're doing, which will be amazing.
So initially you didn't have, so before the research success, the funding success that you had, you committed to having a group, a national group associated with the research team. There's a financial commitment that needs to be settled with that, and that's something that everybody really struggles with. Can you talk us through the strategy to enable funding such a group on a long-term basis and what you might be doing going forward?
Yeah, no worries. You're right, that definitely is a challenge. So time and resource to facilitate consumer involvement is hard. And as Geoff alluded to, having someone available within a research delivery role, like my kind of role, I think is really critical in respect to having the time and resource and expertise to run and manage that kind of association. You also have the cost of offering honoraria to your consumers, which of course needs to be funded somewhere. In our case, we were very fortunate. Our research program is funded and my role is funded through a bequest. It is a finite pot of money. So unless we successfully manage to get further funding, you know, there is definitely a limit on where we'll get to with it. But certainly having someone, and whether it's a clinical research coordinator or a nurse there who can spend time to establish those relationships, run your meetings, set up your panel, engage with people, really take on feedback, I can really see where it's a challenge for a lot of researchers and groups to fit that in. So it requires investment. Where that money comes from, I mean, wouldn't it be great to see centrally funded consumer engagement, right? So this was brought up again earlier this week, you know, the government are behind consumer engagement, so how fantastic would that be to actually have that supported and the honoraria paid centrally to make it easier for researchers. I don't know if you'd add anything to that, Ben.
Yeah, well, let's hope sooner rather than later there will be opportunities available for that sort of opportunity to be there. I know that the Medical Research Futures Fund has just formed their first consumer advisory panel, which actually I'm lucky enough to be a part of, and might be one of the first things that we talk about when that group meets for the first time. Geoff, just before we go, mate, can I give you the final word? If you were to offer some advice to consumers out there who were, you know, tentative about getting involved in research with researchers, what sort of advice would you give them just quickly before we close up?
Well, it's not a fixed commitment. It's not like you're in a paid job where you better perform. And I would say it depends on your motivations, but generally people who are doing this are motivated because they want to contribute something, and it can be quite rewarding, I suppose, for people that you find that your input is valued, and I think Kelly tries to fit the various people with a range of different things where they can best contribute, and that's one of the useful things. Not everyone's doing it all exactly the same stuff. We all go to the panel meetings, of course, but then she'll use the resource, I suppose, she's got in a flexible way. I suppose she could tell you more about that. But I'm aware that does happen. Not everyone does all the same stuff. But,
terrific, Geoff. Look, thank you so much for your time today. It's been a pleasure to speak to both you and Kelly. I hope everybody has got a thing or two out of our discussion, and we look forward to hearing all the great work that goes on around the country with consumer involvement going forward. And hopefully Angela will be able to host another one of these with another fantastic case study in the not too distant future. Appreciate you having us today.
Thanks, Ben. And Kelly and Geoff for your insights and for sharing your experience. It's been wonderful listening to you, and we've got a lot of questions that have come through. We've generated responses to some. There's just perhaps in the few minutes we've got left, I might just pick up another quick one, a couple of quick ones if that's okay, back to our panellists. And just to check in, have you done any evaluation work on your consumer and community involvement activity? And the impact of it, and if you have had some high-level insights around how you went about it.
Yeah, I would love to have the answer to that, because one of our consumer panel members has suggested that, which I think is a great insight. I guess because when we set it up, the intention was, and as I say, we were doing a lot of learning. So no, we didn't put that in right at the start to look at that, and we don't have a formal way of doing it. So we've talked about putting together a report that just goes through how many studies we've reviewed, how many meetings we've had, the membership is to have a look. But when it comes to actually measuring the impact, I wish I had the answer to that. And I would love to hear from anyone who does, or any consumers that might have ideas as well. And I know we'll be talking about that at our panel as we go on. So sorry, I don't have the answer, but I would love to know.
I think it's one of our challenges, isn't it, is being able to tell a story around the impact of the really important work.
And yeah, and of course we're going to have different impacts, aren't we? You know, there's impactors may need to be described to help fund this and to really secure the importance of this from our funding bodies. And then there's the human impact of, you know, how do we measure that?
Absolutely. Before I close out, I just wanted to hand back to Deb to make any final comments.
Thanks, Angela. I was just going to say on the measuring impact, it's an enormous gap in the area of consumer and community involvement in research, but it's one that, and Angela, I know you're involved in this, but nationally there's a great discussion happening about what should it look like and how do we go about it. And the CCI program and WHDN are hoping in the next 12 months to be able to pilot a number of different tools to begin, at least begin, instead of saying, oh yeah, we're working on it, to actually begin to do that. But in the interim, can I just say, capturing voices and being able to present stories that's what we use for decision makers and executive. And if we can, get those people in the room to speak to the why behind it. The return on investment, sometimes you can't put that into a dollar function, but it's much harder for an executive to say no when they've just heard the story from a researcher and someone with lived experience, a consumer, as to how it's completely changed, not only the way the research is done, but also what's happened as a result of it, that it's actually impacted the end, the translation, that it's made a change to treatment, or it's made a change to policy, or something else. So hang in there, watch this space. And you know, Angela and I, we won't give up in this space. We'll continue to get some traction, because it's really needed. We need to be able to compete for dollars to say it's a worthwhile investment. But thank you again for having us, and get in touch. I know, Angela, you've shared our contact details. We'd love to, but you guys in Victoria have got an amazing team at Monash, and we just, it's part of we share the love across the way. So we're more than happy to help however we can.
Wonderful. Just to close out, sincere thanks. Wonderful to work with you all. Thanks to everyone for joining. We'll circulate a recording of today's session, which will have the slides embedded in the presentation as well. Please reach out to either of our centres if we can support, if you want to link into our activities. And we look forward, we have another session in about 2 weeks' time on CCI and clinical trials. Please go to our website for further details. And thanks again to our collaborators from Western Australia. Great working with you. Thanks, everyone.